I am Dr. Grace Margaret Malindi from Malawi. Yes, I am a social scientist within the agriculture sector, and I retired as the Director for Agriculture Extension Services in Malawi. That was 2011. But before that, I had already started feeling weak in my knees. I could not lift myself very easily from lower levels. If I were getting seated on a chair like this, I would struggle getting up. I suffered that over the years, just taking sometimes physiotherapy sessions, sometimes just being encouraged to go on as it is, thinking it would get better. But 2020, my doctor, orthopaedician, recommended that both knees should be replaced.
Hi, I'm Dr. Sunil Kini, Senior Consultant, Department of Orthopaedics and Robotic Joint Replacement, Manipal Hospitals, Old Airport Road, Bengaluru. I first saw Ms. Grace Malindi, a 71-year-old lady from Malawi, Malawi, about 3 weeks back in my outpatient clinic. She came to me with increasing pain in both the knees. Giving you a brief insight, her knee pain started almost 15 years back, for the first time 2008, which later increased from the past 5 years to such an extent that she couldn't walk much or get up from a low sitting position or walk for long distances. In the past 1 year or so, the pain increased gradually and significantly to the extent that she is now. On examination, found that she had painful knee movements throughout the range. We did x-rays to find out that she had got advanced arthritis of both the knees, which was in stage 4, meaning bone on bone. We counseled her that in advanced arthritis, the only treatment possible is a total knee replacement, which would make sure that she is pain-free and mobility would be restored. We discussed all options of the types of joint replacement that we do, which is conventional, and the more recent robotic joint replacement that we offer to all patients. And she decided to go with the robotic joint replacement surgery. So we operated both her knees, and now it's almost 3 weeks later. She's extremely fine. She's able to walk with minimalistic aid. She's got a good knee range of motion, and pain is very minimal. We expect that with good physiotherapy, she's going to do extremely well in the near future.
I was very, very relieved and felt very confident when I met Dr. Sunil Kini, who explained that that surgery, I'm lucky that there's also another technology that is going to be rolled on within Manipal Hospitals. This is the only hospital that has started operating on robotic surgeries for the knee replacement, and I assured me that I needed it because of my age and also my weight. I shared that with my family, and we were very happy to support it, and that's what I went through. And it has gone on so smoothly so far, and with the help of the physiotherapist. And just the day before yesterday, she started walking me upstairs. We took one staircase at a time. The day before yesterday, we took 3 staircases up and down, which I didn't believe I would do. And I was worried. In fact, I was reflecting when I go back home what will happen, because the first thing I meet when I go to my house will be steps. How will I get up the steps to get into my house? But now it gives me more confidence to do the activities which I was doubting I would ever do, that they can start going on smoothly. Yeah, so now I'm really going back home happy, to look forward to carry on with my business, because I travel a lot, both inside the country and outside the country. I don't know if I mentioned to some of you, I've already been here, India. Once I went to Hyderabad. Yeah, so this was like my second time coming for medical attention. So I'm very hopeful that my life will not be as disturbed as I thought. I will have to be geared up now to get up all my ropes and put together, and my businesses to continue to go successfully, as well as the people that I work with at home, to give them more hope also for better survival.
So robotic joint replacement is something that we offer from the past month or so. The robot that we have is the Mako robotic system, which offers a whole array of services including total knee replacement, partial knee replacement and total hip replacement surgeries. So the advantage of robotic joint replacements are both short term and long term. In the short term, robotic joint replacement offers benefits like reduced pain post surgery, a more normal gait and a reduced hospital stay. In long term is expected to give excellent result in terms of the longevity of the implant. So we at Manipal Hospitals offer robotic joint replacements in all areas of knee and hip surgery.